NCM-106 Pharmacology. Good day, my name is Janoce Jacinto. I'm student nurse from Block BSN 210. Mefenamic acid, myferin, drug class, other non-steroidal anti-inflammatory agent, NSAIS, NSAIDs, BA class, MS120, chemical name, antranilic acid, molecular formula, C15H15NO2, class number 61-68-7, indication, relief of mild to moderate pain including headache, dental and body pain, traumatic and surgical pain, dysmenorrhea, menstrual cramps, and menorrhagia, heavy or prolonged menstrual period, symptomatic relief of pain and inflammation due to musculoskeletal and joint disorder, including arthritis. Pharmacological properties, mefenamic acid, an antranilic acid derivative is a member of the penamid group of non-steroidal anti-inflammatory drugs and NSAIDs. It exhibits anti-inflammatory, analgesic, and antipyretic activities similar to other NSAIDs. Mefenamic acid inhibits prostaglandin synthetase. Mefenamic acid binds the prostaglandin synthetase receptors COX-1 and COX-2, inhibiting the action of prostaglandin synthetase, as these receptors have role as a major mediator of inflammation and or a role for postanoid signaling activity dependent plasticity, the symptoms of pain and temporarily reduce. Contraindication, hypersensitivity to mefenamic acid, history of hypersensitivity reaction, for example, asthma, rhinitis, angioedema, urticaria to aspirin or other NSAIDs. Inflammatory bowel disease, history of gastrointestinal bleeding or perforation related to previous NSAID therapy, active gastrointestinal ulceration or bleeding, history of recurrent peptic ulcer disease or hemorrhage, distinct episode of proven ulceration or bleeding, severe heart failure used in the setting of CABG surgery, several renal and hepatic impairment. Next is for the pregnancy for the third trimester. Side effect of mefenamic acid, myrepen, more common, blood urine, bloody black or tarry stool, decreased frequency of amount of urine, heartburn, increased bleeding time, increased blood pressure, increased thirst, ingestion, itching skin rash, loss of appetite, lower back or side pain, nausea, pale skin, severe stomach pain, cramping or burning, stomach bloating, swelling of the face, finger, feet, or lower legs, trouble breathing, unusual breathing or bruising, unusual tiredness or weakness, vomiting, vomiting of material that looks like coffee ground, severe and continuing weight gain. And for the interaction, lithium, methotrexate, antacids such as milk of magnesia, maalox, milanta, or prolates, a blood thinner, warfarin, coumadin, Antomen, heart or blood pressure medication, including diuretic or water-filled, or steroid medicine such as prednisone. Mefenamic acid dosage and administration. For adult, initial dose 500 mg orally once. Following initial dose 250 mg orally every 6 hours as needed. Duration of therapy usually not to exceed 1 week. Used for the relief of acute pain. For the pediatric dose, 14 years old or older, initial dose is 500 milligram orally once. Following initial dose, 250 milligram orally every 6 hours as needed. Duration of therapy usually not exceed for 1 week. Adverse drug reaction, blood and lymphatic system disorder, aplastic anemia, immune system disorder, anaphylaxis, metabolism and nutrition disorder, glucose intolerance, psychiatric disorder, nervousness, nervous system disorder, aseptic meningitis, blurred vision and convulsion, air and labyrinth disorder, air pain, cardiac disorder, palpitation, vascular disorder, hypotension, respiratory, thoracic and mediastinal disorder, asthma, dyspnea, gastrointestinal disorder, gastrointestinal hemorrhage, gastrointestinal inflammation. Overdose and treatment. Following accidental overdose, the stomach should be emptied immediately by including emesis or by gastric lavage, followed by administration of activated carbon. Vital function should be monitored and supported. Nursing intervention, administer mefenamic acid. Myrefen has prescribed by the physician, educate the patient, monitor the medication side effect, assess the patient blood pressure, assess about the allergy, review patient medical history, review of psychological status of the patient. Nursing intervention, administer mefenamic acid, Myrefen, has prescribed, educate the patient, monitor for medication side effect, monitor the patient vital sign, educate the patient on potential allergic reaction, provide education on the importance of medication, collaborate with the healthcare team for individualized care, monitor the patient's response. Research and evidence integration and current research and evidence-based practice related to mefenamic acid. Phenotypic screening of non-steroidal anti-inflammatory drug identified mefenamic acid as a drug for the treatment of schistosomiasis. For the background, treatment and control of schistosomiasis, one of the most insidious and serious parasitic disease, depend almost entirely on a single drug, praziquantel, since the funding for the drug development for poverty-associated disease is very limited. Drug repurposing is a promising strategy. In this study, 73 non-steroidal anti-inflammatory drugs NSAID, commonly used in medical and veterinary field, were evaluated for their anti-schistosomal properties. Method: the efficacy of NSAID was first tested against adult Schistosoma mansoni ex vivo using phenotypic screening strategy. Effective drugs were further tested in a murine model of schistosomiasis. The disease parameter measured were worm and egg burden, hepato, and splenomegaly. For the findings, from 73 NSAID, 5 mefenamic acid, sulfenamic acid, meclofenamic acid, celecoxib, and diclofenac were identified to effectively kill schistosomes. These results were further supported by scanning electron microscopy analysis. In addition, octanol water partition coefficient, both for neutral and ionized species, revealed to be a critical property for the ex vivo activity profile. Compounds were tested in vivo using both patent and pre-patent S. mansoni infection. In a mouse model, the most effective NSAID was mefenamic acid, which highly reduced worm burden, egg production, and hepato and splenomegaly. Interpretation: the treatment regimen used in this study is within the range for which mefenamic acid has been used in clinical practice. Thus, in this demonstrated the capacity of mefenamic acid to act as a potent anti-schistosomal agent suitable for clinical repurposing in the treatment of schistosomiasis. For the keyword, schistosomiasis, non-steroidal anti-inflammatory drugs, mefenamic acid, anthelmintic schistosomicidal activity. And for the references, thank you, and that's it for today. Thank you very much.